Coming up today, understanding Parkinson's disease. It causes tremors, stiffness, and much more. And new numbers prove it's more common than we realize. Good morning, I'm Jessica Lovell. Welcome to the Morning Medical Update. According to the Parkinson's Foundation, around 1 million Americans live with Parkinson's disease. There is no cure, but research is happening every single day as doctors search for better treatments. We are joined today by some of those doctors. Dr. Rajesh Pahwa is a neurologist and movement disorder specialist. He is the director of the Parkinson's Disease and Movement Disorder Program here at the University of Kansas Health System. How are you?
Good. Thank you for having me.
Always great to have you with us. And he has brought along two of his fantastic colleagues. We've got Andrea Lee and Dr. Kelvin Au. They are neurologists and also movement disorder specialists. So good to have you both here with us today. Joining in on this conversation, I know you will have plenty to add. We're also happy to have Pam Sullivan joining us remotely. She has been living with Parkinson's for 10 years now. Pam, good morning to you.
Good morning. I'm glad to be here.
Yes, thank you for sharing your story with us. Dr. Pahwa, Parkinson's disease, PD, it's a neurological condition. What happens in the brain if someone has it? And why does it cause symptoms like tremors that we commonly see with someone with Parkinson's?
Right. So Parkinson's disease is what we call a neurodegenerative disease. It's the second most common one after Alzheimer's disease. What happens is there are certain cells in the brain that are dying. And what happens, it also reduces certain chemicals in the brain as well as connections in the brain. The most important chemical that is reduced in the brain is dopamine. And when you lose dopamine, you have the slowness, the stiffness, and the tremors also along with it. So that's pretty much what Parkinson's disease comes down to. And one of the things we keep looking at it is how can we protect these cells? How can we slow Parkinson's disease? Because there are cells that are dying faster than we would like them to.
I want to ask you about a new study that was published just this past December. This was found Parkinson's that was 50% more common than previously reported in the U.S. and in Canada. Previous estimates said there were about 60,000 new cases every year. New data shows 90,000 yearly cases. So, Dr. Pahwa, why are the cases on the rise? Is it just being better diagnosed, or is it actually appearing more?
Right. So the most common risk factor for Parkinson's is aging. The population is aging, so as we are aging, we are seeing more patients. The other thing is the previous studies that were done that came out with 50, 60,000 new patients a year and about 800,000 the number of Parkinson's patients in the United States, and now we talk about 1.2 million after the new study, is that this is a much more comprehensive study. It included 5 other studies. Previous studies have looked at small areas in the United States and then tried to say, okay, this area, there are so many numbers, so in the large area, how many would be? So this kind of gives us a view of the entire United States, and it also shows us that Parkinson's is not as the same prevalence throughout the country. There are certain areas in the U.S. that have more Parkinson's than other areas.
We're going to talk more about that as well. Pam, you eventually came to the health system for a second opinion. Tell us about that first opinion.
Well, I went to see a neurologist that was recommended by my primary care physician, and this person was not a movement disorder specialist, just a neurologist, had a different specialty, and I felt like she didn't have all the information that she needed. So I went to see her. She said, oh, well, I can't tell if you have Parkinson's or not. That's what tremor typically might mean. So here's some medicine you can try. It was a dopamine agonist, which means that it replaced the dopamine. And go see if that does anything for you. We don't want to put you on carbidopa, levodopa, because that only works for a short period of time, and you want to save that for later. So I went away. I did not get better. I got maybe a little bit worse, and I thought, I'm going to go see what somebody else has to say, and that's how I found Dr. Pahwa and KU.
So how important was her coming here and getting that second opinion? Would you hear what she was being told originally to what she was able to get here?
Yeah, I think it was very important. I think patients with Parkinson's should at least see a movement disorder once, if not more often. We do know patients who see movement disorder neurologists do better than patients who see neurologists, do better than patients who are seen by general practitioners. Unfortunately, there are not enough movement disorder specialists in the United States that every patient with Parkinson's can see a movement disorder specialist. But the issue is, levodopa works throughout the disease course. It doesn't stop working. As the disease is advancing, we need more dopamine. So the same amount of levodopa that we use initially would not kind of control the symptoms later on. But I think that's a very wrong perception a lot of people have out there, that levodopa only works for a short period of time, and if we delay it, we may use it later in the stages of the disease.
Pam, you shared a short clip that shows one of the tremors that you were having. You were on vacation, and we can see your right hand shaking here. How often was this happening, and how was it impacting you just in your daily life?
Well, you can imagine that writing is difficult when your hand does that. Also, I'm still working, so I use a computer and use a mouse. I had to buy a specially adaptive mouse to be able to use it. In some ways, though, I think I was blessed because that's basically the only symptom I have right now is the tremor. But I was taking medicine every 2 hours at that point, and it was not controlling the tremor for even probably 30 minutes of that time. So that was, I don't know, irritating, disconcerting, mostly annoying because at this point it was not debilitating.
Well, Pam, you mentioned work, and as part of your job is giving presentations, and you share a slide that you use during the presentations to help people understand your tremors. Kind of walk us through this. You kind of have a way to put people at ease by sharing this with them.
So this was the first presentation that I had done where the tremor was really obvious, and I was doing it in person for a bunch of our clients. And I wanted them to know what I'm doing with my right hand because I clenched a fist trying to control it, even though I couldn't really do that. But so I just told them, I'm not preparing to punch any of you. I'm not preparing to break out into song, and I'm not preparing to throw you a curveball as I hide my hand behind my back. I wanted to put it in the room that I do have this disorder, and that if anybody wanted to talk to me, I was open to talking to them. But I think it was better to name that elephant in the room than to just pretend that nothing was wrong and have everybody go, what's going on with her?
Well, yeah, less distracting so they can listen to your presentation. But I love you talking about the elephant in the room because I can imagine there's other people that have gone through it, have a family member, or maybe in the future will go through something like that. So I really commend you for doing that in kind of a lighthearted way. I want to ask Dr. Lee, the standard drugs, there are some standard drugs that treat symptoms like tremors, right? Can you talk to us a little bit about that, the tremors that Pam was experiencing?
Yeah, so levodopa is a mainstay of treatment that was developed in the 1960s. And since then, dopamine agonists are available as well, which help tremor, stiffness, slowness. Those include pramipexole and ropinirole, and rotigotine is a newer one. That's a patch form. We have also available MAOB inhibitors, which help to augment the amount of dopamine in the brain by limiting breakdown. And there's also anticholinergics that are used, such as trihexyphenidyl, although they have some side effects. Amantadine as well can be used to treat tremor. So there's a whole arsenal of tools that we have at our disposal to help treat the Parkinson's patient, to manage their tremor, stiffness, slowness, and walking issues. However, the biggest, most important thing they can do is exercise. Physical therapy and exercise has actually been shown to slow down progression of Parkinson's, and it just helps people feel better, they move better, you know, they can take action that way. Movement
is medicine, as we always say. What were people doing? Remind me again when these medicines started to come to the forefront, and then how were they managing it before these medications came along? Or maybe Dr. Pawwa, you can jump in as well.
Yeah, so there was very little we could do before that. There were other stuff that was tried, for example, belladonna, which are anticholinergic drugs. The problem with those anticholinergic drugs are they cause a lot of side effects and they only help the tremor. So it really was a major challenge. Different kinds of surgeries used to be done, and often the patient used to end up being worse rather than better. And it's kind of from there we ended up with deep brain stimulation So that's one of the initial things where we happen. But levodopa was the first thing that revolutionized the treatment of Parkinson's disease.
Dr. Au, I want to bring you into this conversation. We mentioned exercise, good for everyone and anyone, but what can patients do to manage symptoms besides using a medication?
Yeah, so exercise is very important. I want to hit that home. You know, that's a very important question that we always get asked. The other thing is drinking fluids, lots of water. There's a lot of symptoms of Parkinson's that don't include the slowness and stiffness and tremor. Things like constipation, low blood pressure. I recommend to my patients to drink up to 64 ounces of water a day if they can to help with those symptoms. And then when medications don't seem to be cutting it, as Parkinson's progresses, we move on and talk about advanced surgical options, including deep brain stimulation and focused ultrasound as other non-medication treatments for Parkinson's disease.
So I want to talk about the deep brain stimulators, Dr. Pawat, you had just mentioned. You implant these into the brain. Sometimes they can stop Parkinson's tremors, correct? Or is it just for essential tremors? And tell people what the difference is between that and how they work.
Right. So essential tremor is where patients only have tremors.
Okay.
So when they are trying to do something, the tremors really get worse. They have a hard time eating, drinking, kind of a thing, and they don't have any other symptoms along with it. So they don't have
Parkinson's.
They don't have Parkinson's. They don't have slowness. They don't have walking difficulty. It's purely tremor, but their tremor is more while they are trying to do stuff. So that's why they struggle with writing and other things. In Parkinson's disease, in addition to the tremor, they have slowness, stiffness, and walking difficulty. So there are other symptoms also involved. So that becomes a bigger challenge in Parkinson's. When we sorry, you want to go ahead and talk?
No, I just wanted to, this deep brain stimulator, I just wanted to, so people, when they're seeing this video, can see what you're doing. You're actually implanting this into the brain.
Well, yes, but actually the surgeon does it. I don't go to the
not
OR.
do that.
Dr. Au goes and helps the surgeon in the OR.
You can't do it all, can you? You don't do it all. But so this was mainly used for essential tremors, but are you using this on Parkinson patients?
So it was initially started for tremor, both essential tremor and Parkinson's tremor. But then we found out implanting this electrode in a different part of the brain, we can help the slowness, the stiffness, and the involuntary movements. Those are dyskinesias where patients at times cannot sit still and down. So we can help pretty much all the symptoms that a patient has with Parkinson's. Of course, we cannot stop the disease. We cannot help the falling. We cannot help the people who get memory issues and all that. So those still happen. But the roller coaster that the patients have, we can pretty much even them out so their life is much more predictable and they are not wondering how long my medicine is going to work or not work.
Sure, managing those physical symptoms. Just to give you an idea how the deep brain stimulator works after it's been implanted, we want to show you, because these patients are asked to draw this spiral, and very difficult, as you can see in the beginning, but then right after, almost instantaneously, I understand, you can start to see a smooth circular motion without the tremors. Dr. Lee, Dr. Au, I know you've seen patients get the stimulator turned on. What is that like in that exact moment for you as physicians, but also, of course, the patients?
It can be pretty dramatic and very, rewarding to see. We get them to come in after 4 to 6 weeks after the deep brain stimulation is placed. That probe is placed. That's not the treatment. The treatment is actually turning it on and giving the electrical stimulation to interrupt the abnormal tremor circuits. And it can be pretty dramatic. Within a few seconds, us turning it on, their shaking that they have in their hand quickly goes away. And
we're an instant gratification society, and in this case, when it comes to your health and something like that, it would be very impactful. Dr. Lee, what's that like in those moments for you and your patients?
Extremely satisfying to see when it gets turned on and the tremor just melts away. It's the coolest thing ever.
Just they're starting down the path of a better life. And does this mean that they won't need medication if this works for them? Would they still need medication or a combination?
Generally, people continue medications. As Dr. Pawat mentioned, it doesn't slow down the rate of progression of Parkinson's, but it can help manage the symptoms. With deep brain stimulation, we're able to reduce medications for many people, which is very helpful if they're having some side effects from it. But they generally continue a little dose for most patients.
Who wants to tell me about focused ultrasound?
So focused ultrasound basically is the concept like I talked about earlier. When they were initially trying surgeries for Parkinson's, they would put a probe in the brain and burn that part of the brain, basically interrupting the circuits in the brain. So, but for that, you needed to drill a hole, you had to cut open the brain and all. So with focused ultrasound, what we are doing is basically taking ultrasound waves and bringing them down into the brain into a small point where we were originally creating lesions, or where we put the electrode in deep brain stimulation. The best way to explain it is, as kids, we used to go out in the sun, hold a piece of paper with a magnifying glass till the paper actually burned. And it is kind of a similar concept, except using the sun rays, we are using ultrasound waves all into one spot and burning it. The patient doesn't need an incision, the patient doesn't need to have a hole drill, so it's all basically based on ultrasound waves.
I didn't know that actually really worked, the paper and the magnifying glass trick.
You never went out in the sun and
No, I'm going to try it though. Don't tell my kids though, but I think that sounds fun. Okay, if you want to read more about Parkinson's and other movement disorders, visit the website kansashealthsystem.com/Parkinson's. Information right there on your screen. Dr. Pawa, let's talk Parkinson's research. What's up?
So Parkinson's research is really, at this stage, in the last 30 years that I've been involved with, we are really doing a lot more today than we have ever done. So from that standpoint, we are really into a whole different medications, all the way from slowing Parkinson's disease to actually helping the symptoms that the patients are having, including these roller coasters that the patients struggle with. Our biggest unmet need today is how can we slow the disease, how can we cure the disease. So for that, we have to look at certain things, certain proteins in the brain cells, which we believe might be the reason why patients do develop Parkinson's. And if we can clear these proteins, maybe we can slow the disease, maybe we can even someday cure it. The other big thing are the genes. 5 years ago, if you have asked me, I would say, I don't see any reason for doing genetic testing. Now we try to do genetic testing in pretty much every patient, because we know about 15% of the patients in our clinic have one of the most common 7 genes in Parkinson's. There are over 20 genes in Parkinson's, but there are some of them which are the most common. What the research we are doing now is patients who have a specific gene, we are actually looking at drugs that can work on those patients with those genes, so we can actually look at the focal group of patients rather than using the drug on every patient. I often tell people, where cancer was 20 years ago, that's where we are today. They know so much more about the genes. They use targeted therapy based on the genes, so that's where we are just starting off today. The other thing we are doing is stem cell is always a big thing. Patients have been waiting for it. Right now, phase 1, phase 2 studies are starting in stem cells. Hopefully, we'll be having our first patient sometime later this year. So that's going to be another thing. Then we have gene studies, which actually we put genes in the brain, and they actually help replace certain chemicals in the brain. So I could sit here with you and talk all day about the different trials and different studies that are going on. But really, right now, it's an amazing time, and very fortunate for Parkinson's patients, because there's so much being done.
Very promising. I'll have you back on, though. We'll talk more about those trials and studies. And I want to bring in Pam, because you got involved in some Parkinson's research. You told us that it helped you think differently about Parkinson's disease. How so?
So when I was first diagnosed, I felt like I had been singled out for some unfortunate thing to happen. And participating in research allowed me to think of my experience more in terms of a science project. I was actually doing something that was research that was perhaps finding a cure or finding a treatment that was effective. And that made me not think of myself as a victim, but to put me more in charge and to contextualize the whole experience differently. It's been very helpful for me.
I want to talk about a headline, and we'll start with you, Dr. Lee. Last month there was a headline talking about the study of a link between Parkinson's and a chemical used in dry cleaning. You say it's not just dry cleaning. Tell us what you know.
No, this chemical, TCE, trichloroethylene, is widely used in certain industries such as aerospace, aviation, and it's used to clean and degrease metals. It's used in dry cleaning agents, and even is found in some gun cleaner agents. So, people have been exposed to it over their lifetime. Even back until the 1970s, it was used to decaffeinate coffee. So, the problem with, getting to the link is people are not aware that they have been exposed. The exposure happens decades before the onset of the Parkinson's. And it just, in our environment, it seeps into the groundwater, it evaporates, we breathe it into our air. It has been linked to the degeneration of those dopamine-producing neurons in cell studies as well as animal studies, and it's a terrible thing.
I want to talk more about that because I want to know what we're to do with it, if it's avoidable or not. But I want to see if our community has questions. So ask them. Use our chat on YouTube, Facebook, tweet us, email us at the Medical News Network. Info is right there on your screen. Let's get a quick check on our COVID count. Dr. Dana Hawkinson, good morning.
Yeah, hi. COVID count's staying steady, just above 20 active infections. But today we have 39 total, 21 active, 3 in the ICU, and 1 on the ventilator still. So we are seeing severe disease continuing here at the health system, unfortunately.
Doc Hawk, RSV vaccines right around the corner.
Yeah.
2 new studies show they are effective in older adults and pregnant women.
Yeah.
Just remind us about this vaccine and why they're so important.
Yeah, so RSV has been, troublesome for quite some time, and they've been looking for vaccines or protections from that for over 40 years, and that is, some of what Barney Graham was doing prior to getting in and helping create some of the SARS-CoV-2 vaccines. So this is a very good breakthrough. Remember, RSV is typically a disease of very small children, especially under 6 months of age, but also of the elderly as well. So it does have those kind of a bimodal attack for the very young and the very old. What these new vaccines can do, and I think we do expect them probably in the fall or later in the year, is to come to market. They are able to help and provide protection against severe disease. One is for mothers who get the vaccine during late in pregnancy. That then transfers antibodies and protection to baby. And then the other vaccine is for the elderly as well, above 60 or above 65. So overall, this is good news. Hopefully one more thing to help keep people out of the hospital.
Doc Hawk, thank you so much. Any reporters with us today? Let's get to our community questions. And thank you to the community for jumping in. A lot of great ones this morning. Let me ask one. Jeremy's asking, do tremors keep you up at night? Do you just stop noticing it after a while? Pam, what can you add to that? Does it make it hard to sleep?
Having Parkinson's can make it hard to sleep. I don't notice tremor at night, so I can't really tell you if there's tremor or not. So it doesn't keep me awake. I would say that to Jeremy. And the thing that might be more troublesome is one of the effects of medication can be vivid dreams. So strange and vivid dreams would be more likely to be bothersome than the tremor itself at night, for me.
But usually when a patient goes to sleep, the brain goes to sleep, and any tremors and other things also stop.
Yen Liang wants to know, would like to know if receiving Botox injections can help alleviate tremors for Parkinson's patients.
So right now we are doing a clinical trial in patients with essential tremor looking at botulinum toxin to help with tremor. We did studies over 30 years ago, and at that time the problem was the hands got too weak to slow down the tremor. So we have to balance the dose that it doesn't cause weakness, but it helps the tremor. The current study gives us a little bit more flexibility in the dosing we use. Right now, Medicare and insurance companies do not usually pay for botulinum toxin for tremors, but hopefully if this study is positive, that would be more likely that would be covered.
Joellen has a good question. My mother was diagnosed with this disease in her early 80s. What is the hereditary component? Her mother was adopted, so she doesn't know any of the family history. So anyone jump in on any of this about the hereditary component?
Yeah, as Dr. Pao mentioned, that there is a genetic component to a certain percentage. We estimate that to be about 10 to 15% of people with Parkinson's having a genetic component to Parkinson's, but most of the time it's what we call idiopathic, or we don't know exactly the cause, but it could be environmental. We've touched on different solvents, pesticides. People in the same family, they could be eating at the same table, being exposed to the same different environmental toxins that can cause Parkinson's. So that's field of research that we're expanding
Sure.
on.
So in some ways not avoidable.
Right, and I would tell her just because her mother, she's adopted, I understand, but even if patients have a particular gene and the kid has the gene, we still cannot say that person is going to develop Parkinson's.
You can have the gene but not get it.
Exactly. So people need to let the time go by, let research go by until we can answer some of these questions.
So on that note, David wants to know, what's the first sign? Because everyone's different. What would be those very initial signs?
There can be a prodromal phase to this, so non-motor symptoms such as constipation, acting out of dreams, just sleep disturbance, mood issues, anxiety, depression, losing your sense of smell can happen years or even decades before the onset of the motor symptoms, the tremor, the stiffness, the slowness. So, we typically think of the motor symptoms as, the start of Parkinson's, but actually it happens way before.
All right, I'm just sifting through some of these really good questions. Angela wants to know, any research on CBD?
So CBD, there are a lot of people who use it, have used it. We don't have any good controlled studies that we can say this makes a difference, or also THC that does make a difference. So at this stage, you have to be very careful because there are so many different brands of CBD, and if it works, it doesn't work. Even in the best of the studies that are out there, all we can say is there are some studies which may show it may help sleep, it may help anxiety, it may help loss of appetite, but not really the true Parkinson's.
But like help the symptoms of the symptoms. So,
Correct.
Okay. Let's get our takeaways today. I want to go around the table. And Dr. Lee, I'll start with you. What do you want folks to take away from our talk today?
Well, diet, actually a Mediterranean-based diet full of fresh and processed foods has been shown to reduce the risk of getting Parkinson's. Once you do get Parkinson's, it probably helps slow things down. Exercise also has been shown to reduce the risk, even if you have a genetic predisposition to this. So everyone should be exercising. This is how we have healthy aging. This is how people age gracefully and reduce the risk of not just Parkinson's, but also dementia, diet and exercise. Once you do get Parkinson's, it's a good idea to come to a comprehensive multidisciplinary center such as ours at KU, because we can offer so many different treatments from different modalities, as well as research studies. Participation in research is extremely important and furthers our field and understanding of the disease.
Well said. Dr. Al.
Parkinson's, yes, it's a progressive neurodegenerative condition for which we don't have a cure for just yet, but there are advancements in treatments that have occurred just even in the past 5 years. There's new treatments every year that we can use to help manage the symptoms so that you can have the best quality of life possible.
Well, knowing the three of you are getting after it makes us feel a whole lot better. Dr. Pawat, takeaway today.
Yeah, so I think the first thing, let's talk about causation. It really is important to realize that, like Dr. Au mentioned, it's really, we believe, an interaction between genes and environmental chemicals. So even if you're exposed to certain chemicals, you may not develop Parkinson's. And the other thing is also the amount of chemicals you're exposed to. We haven't done, or we don't have any causative studies. They are really basically association studies. So we have to be very careful. I don't want someone to go take a bath in trichloroethylene, but at the same time using the laundry for their clothes is not a huge concern from that standpoint. The other big thing is research. Why were we able to come up with a vaccine for COVID in a year? Because everyone wanted to participate in studies. For Parkinson's, less than 5% of the patients are willing to participate in study. That's the biggest delay we have in trying to find something to slow the disease. The other thing is, for slowing the disease, we need people before they start their medicine. Once they start the medicine, then it kind of affects us as far as, is it the medicine making a difference, or is it the research drug that's making? And the patients are too late to participate in those studies.
So carve out some time and come back and let's talk about it and get the word out. Sound good?
Definitely.
All right. So Pam, what do you want folks to take away today from your story and our conversation?
I hope people would be encouraged to seek out research if they have an opportunity to participate. Being in research has been great for me. Like I said, it let me think about the disease differently. And I thought maybe I'd just put in a disclaimer here that despite the white hair, I actually was diagnosed with Parkinson's fairly early in my career. I'm in my 60s now, so that 10 years ago I was only 50.
Well, we think you look great, and you're working hard, and you're getting the word out and changing lives. So we appreciate you, and again, your help in our research as well. Pam, thank you for being with us today. And Dr. Hawkinson, final takeaway.
Yeah, just thank you to our guest, Dr. Pawa, and I have had quite a few patients over the years, and just to reinforce Dr. Lee and Dr. Au's message, you know, a healthy lifestyle is vitally important, especially staying physically active and having that functionality. Should something happen like this diagnosis or cancer, that all helps to keep you better prepared for getting through those illnesses in the future. So. All kudos and thanks to our guests.
Absolutely. Well, a new episode of All Things Heart is coming up at 10 a.m. When Stuart Steffen and his wife heard 3 little words, they understandably had a big reaction.
I think our biggest concern was having open heart surgery. You know, I mean, that just the sound of it is scary.
Then they met the doctors here at the University of Kansas Health System who could perform the surgery with the help of a robot. And that surgery promised to have Stuart recovering from home just days later. That story is coming up at 10 o'clock on All Things Heart. Thank you again to all of our guests and our viewers for being with us today. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update.
I don't think I let myself be fearful because I knew if I was going to die, I was going to die.
Fearless in the face of cancer and a heart attack. I'm Jessica Lovell on the next Morning Medical Update. How her bleak prognosis transformed into survival and inspired her husband to start writing. Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.